Okay, so here's today's dental. Dexter came into boarding, which is where we do most of our dental checks. So his owners signed the consent forms and agreed for us to do the dental while they were on holiday. So here I am just having a look at his mouth. This is generally what they do when they first come in so we can discuss it with the owner. And you can see a lot of discoloration on his teeth there, particularly the front canines, and a lot of tartar buildup on those back top carnassials. He's pretty cute. And here is the tour of the surgery room where we perform the dental. So the table set up with some towels. There's a heat mat underneath. One towel for rolling under the neck and the other towel for covering the patient to keep them warm. Here's our dental machine, the IM3. So there's the scaler, the polishing head, and you've got to make sure it's turned on to the right setting, obviously. So you're not using the drill instead of the polishing head. And those are the pedals. There is where the air pressure hose hooks up. And we've just covered it with a mat so we don't trip over it. And there's the air compressor turned on and the little knob in the right position there to let the air flow. And just a power cord back into the PowerPoint. Yeah. And obviously you want to make sure the water in the CLS thing is full before you start, otherwise you'll be burning some teeth. So here is our dental kit. There are the autoclaved pieces we use for extractions generally. So we haven't used them in a while, as you can see. There we have our pharyngeal swab. These are the common instruments, the sharpening stone, the root elevator for weakening the ligaments that attach the tooth, the dental probe and explorer, so explorer on that side and probe on the other, the root tip pick. Oh no, that's the scaler. And the mouth gag that we tend not to use on patients that are small as cats. The tartar cracking forceps, which I had a mad video of but was lost, and the extraction forceps, so good for gripping. And there's the little ring we wear with the prophy paste in it to make it easier for us. There's some spare burrs. Okay, so here we are prior to beginning the dental. Once the patient has been anaesthetised, just making sure to lube the eyes so that debris and water particles don't get in there. You can see that the towel's rolled under the neck, so any water that gets into the mouth is going to flow downwards out of the mouth. And here we are examining. I'm using the probe to measure succulus depth. The tartar was so built up on these teeth that we weren't going to find any like pockets or scratches or anything with the explorer at this point, but we would do that later in the dental. So despite how bad the tartar was, like, it wasn't really a significant depth, but a lot of crud came out. Yeah, you can see that the belly goes under the gum there. So yeah, that's just checking the back of the tooth underneath. Look at those yummy gums. Yeah, so using the explorer there to check for some divots, but as I said before, it was pretty futile. So at this point on our chart, we would have filled in the teeth were very brown, discolored at the front. Oh, and there's my PPE. Very important: gloves, mask, and goggles. And here is where my camera cut out, so I'm just going to put in some clips. You can see the pharyngeal swab at the back of the throat there, the positioning of the patient. And there's our chart there that you can barely see anything on, but basically just describes the brown discoloration of the front two canines and also a bit of extra tooth that we found in the back of the mouth that wasn't bothering him. So we originally intended to extract the canines, but after scaling and polishing they came up so clean, weren't wobbly, and had no succulus depth. So Dexter got to keep them. Happy ending. and as such, he didn't have to go home on any medications.